let's do our Cahoots. I'm going to try to do it a little fast to try to get it in. There's 100 questions, and I have 1 hour maximum to do it in. So I'm going to try. And with my voice, it's squeaky, but I've got my hot garlic honey ginger tea. As you do the Cahoots, you're going to see questions similar in either the 100 that I'm going to give you the recording from Monday or this one. A lot of similar stuff there. Those are concepts you're definitely going to see on the HESI. So just be aware of that. Another thing I would tell you to do is to make sure that you open up your NCLEX book. Okay, that NCLEX, the red one, the green one, doesn't really matter. On the pediatric area, there are HESI hints there that also will help you. I've heard some students say between the Cahoots, between just revisiting the reviews and then doing the HESI book, they did very well on it. And all of it helped. So that's just from previous students. So let's get going. So multi. What are signs and symptoms of pyloric stenosis? Pyloric stenosis is that valve that's muscular. Food can't go down. And we know this one is projectile vomiting. And they're not getting food, so they're not getting liquid, so decreased urine output, along with that little valve. You can feel it, that olive or that marble, right at that mid to the right up their abdomen. Another multi. Signs of acute respiratory distress in an infant include, remember, there's differences. Some of them, these are infant. You don't really see these in the older child, but in the infant and the young toddlers, these are two things that you do see a lot of. So respiratory distress in an infant, if they're at 52 and they're 1 year old, that's old. A newborn, that 1 month old, that might be normal. So again, that's looking at ages. But grunting and nasal flaring, specific to infants, and of course, any infant coughing, we know that's distress. Another multi. What, while caring for a child, they suddenly stiffen and gave a seizure. What should the nurse do? Again, with seizures, it's always protect. There's nothing you can do. You just keep that airway, right? How do we do that? Protect from injury, protect the airway. You'll see things like turn them over to the side, note the time of the seizure, pad the side rails, get anything in the bed away from them, have suction at the bedside, not to put in the mouth, but to have the area around the mouth. So if they're vomiting, it keeps it open. And of course, if it continues, start an IV. And of course, in a hospital, we would call a code, get people there to help you in case it goes prolonged. Another multi. What may be a problem seen in an infant after open heart surgery? Usually infants open heart surgery, it's usually a congenital heart defect. That means something's wrong. The heart wasn't built normally, whether a hole, whether missing a valve, a chamber. So this is the biggest thing we look out for, and that is failure, right? So they are not eating. They tire out easy. Their heart rate's going to be elevated, trying to make up because they're just huffing and puffing and their lungs are filling up with fluid. So that respiratory distress too. And, you'll have the retractions and everything. These children tire out easy, and these children will lose weight if we don't slow down, just, feed them more frequently, less food, and increase calories in their diet, right? A young man with cystic fibrosis wants to have children. How would you respond to that? Can they? Can a female? Can a male? Now, the answer with female, you can have children. It will be high risk because of nutrition and the respiratory issues that go on. In men, their vas deferens is clogged with mucus. Therefore, they don't produce sperm that can get to the woman to produce a baby. But once they have a bilateral lung transplant 1 year later, they are able to, that mucus decreases, and then they're able to have the sperm and able to have a child. Many men go through the bilateral lung transplant just to have children. An infant with tetralogy of Fallot has a TET spell. What's the priority action? What do you do? TET spell. And this is an infant. Older kids will sit and squat, right? And this is right-sided. This is that pulmonary artery gets blocked off and no lungs, no blood is going to the lungs, so no oxygenation. And then we do that knee chest, and it changes the pressure in the abdomen and the chest. So it does absolutely pop off that whatever or that kink that's going on in that pulmonary artery. So now blood can flow. It is a scary thing to watch them go from pink to like blue in less than a minute. Another multi. The nurse should assess the infant with congenital heart disease for which early signs of heart failure? So they fatigue easily. They have very heart rates getting faster. They're more tachypnic, and you're going to see them. They're just going to just fall asleep while trying to feed them. And in the long term, they're not going to gain weight, either. So again, cognition can be affected if we don't correct it. Nurse provides instructions to the parents regarding administration of digoxin. What do you say you need further instructions? So this is one of those opposite questions. A parents would say what? And you're like, no, that's not what it's supposed to be. So we know at home, probably the only thing that we'll see besides counting a pulse is vomiting. And we know if they vomit, you are not going to repeat it. That's when, if they're vomiting, they call the doctor and they probably have to go in for a digoxin level. Your child's been playing outside in the field with long grass. What would be a priority to assess on these children? I'm from New York, and I remember playing out in the fields and the cornfields and riding my bike and drinking water out of the brooks and creeks and eating apples off the orchard. So, I actually never got a tick, but that's what we look for. And especially if they're out there playing and you find out one of their friends has a tick, what you do is you just check them visually, head to toe, see if you see anything, and then, pull the tick off. Try to get the whole thing out. A toddler presents with sudden severe abdominal pain, and the diaper has currant jelly and bloody stool. What is that? these are usually your toddlers, and they're not, you can't console these children. Their legs are just flaring. And this is the telescoping of that intestines, and it causes severe sudden onset, and that abdomen will be stiff. I mean, these children hurt. How do we treat it? Well, usually they'll come out by themselves, and if they don't, we're gonna have to either do a air or a barium enema, or they might need surgery. Hirschsprung is when the bowel has no nerves, okay? And that's surgery. And it's usually an infant we see that. A 6-month-old infant's placed on thyroid replacements for congenital hypothyroidism. How do you know it's been effective? What are the two things about hypothyroidism and children and why we need to monitor it closely? Well, one of the things is cognitively, they're going to be awake and alert. A 6-month-old should be able to completely turn over. Can't lift the head up, they're behind. Constipation is normal in hypothyroidism. And a reflex grasp, they're just getting to that. But that rolling over is where they should be on the growth and development. So growth, height, and weight. An infant should be able to sit unsupported at what age? And this is 8 months. That is 8 months that you'll see that. 9 months, 10 months, they're getting up, pulling themselves up, and they're creeping a little bit. And by 12 months, they should be attempting or they should be at least walking. A multi. What assessment would a nurse see with a child who is dehydrated? When you talk about dehydration, children, or you see with adults, there's many of the same symptoms you'll see. The one thing though, with infants, younger children, they cry and absolutely no tears come. And it's the saddest thing to see this poor little baby crying. Of course, prolonged capillary refill, decreased urinary output, skin tenting, poor mucus, your mucous membranes are dry, elevated heart rate, decreased blood pressure. There's all of those things. And adult or children, you'll see it. Growth hormones are started on a child. What assessment will show you that the medication has been effective? Remember, growth hormone is given in a subcutaneous injection every day, and it takes commitment on that child and on that parent. It's like having diabetes and needing to give insulin injections. And the way that we know it is they're growing, as simple as that. I've said many times during this course, the one thing that we measure every single visit is height and weight. It tells us about our hormones, like our thyroid hormones. It talks about nutrition. It can talk about growth hormones. It's measuring so many things. It's as simple as they're growing. One of the symptoms of rheumatic fever is chorea. What would you tell the parent about these movements? Rheumatic fever caused by strep. You can have, your joints can be inflamed. You can have a rash. You're going to have the sore throat with it, the strep, which is part of it. But and the heart valve is the only thing, once it's damaged, does not come back. Everything else will improve. Sometimes it is the chorea that brings these parents in with the children to be checked. And how do we treat? It's rheumatic fever due to strep. We're going to give antibiotics. A mother of a 2-month-old is worried because the back of the child's head is flat. What do you tell the mother? And today more than ever, this is prevalent because of SIDS, right? Back to sleep. We put them on their backs. Now remember, as I said, their heads are soft. So put them on tummy time, right? Tummy time is what we do on their tummies. And that does help round out that head really nice when they're really awake. What statement from a parent would be concerning regarding a child diagnosed with croup? Remember, croup that's not treated can turn into epiglottitis, okay? Knowing that, if they're having problems swallowing, guess what? It's turning into epiglottitis, which is a medical emergency. You need to get that trach tray, an intubation tray at the bedside, and start to do treatments for racemic epis, trying to get that airway open so that they can breathe. A child has myopia. What would be appropriate for a nurse to tell the teacher? So this is a child who can't see well, right? Hasn't done anything to do with the muscles of the eyes. Put them in the front of the room and give them big printed books that they can see the letters and they can see the board. A multi. A child born with a myelomeningocele with sensory and motor deficits must be careful with what? That's that big purple blob in the back, right? The meninges, and all of the nerves are ripped up and pulled out. And what they do immediately is put them immediately on latex precautions. And also, these children, if they can't urinate on their own, they're going to get catheterized every 4 hours, even as they grow older. And actually, they're taught that to be able to do that. Aggressive physical therapy, no, they don't need aggressive. They're going to have decreased motion on their low extremities because of the way those nerves were pulled when that myelomeningocele occurred. What interventions are needed for an immunosuppressed child that has a platelet count of 10,000? You know, when you look at this, we're looking at the platelet count. It doesn't matter immunosuppressed or a normal child. Any patient with a platelet count of 10,000, what is your biggest concern? What are platelets for? They are good for bleeding precautions, right? We're going to make sure no IM injections. We're going to make sure that we're watching them for bruising and petechiae. And the adolescent, no shaving the legs, right? That's what a adolescent would want to do in a hospital, but we're not going to allow it. They're going to bleed. An infant was seen in the emergency room for a febrile seizure, and the mother asked, "Does our baby has epilepsy?" What would you tell that mother? One seizure does not make a child epileptic. It needs to be more than that in a day. And it's usually 6 months to 6 years old, and they grow out of it usually. You would teach her things like carry a thermometer and keep antipyretics in your purse. Absolutely. Be very aware of the child's fever. An 18-year-old parents wants their child lab results. I want to know what those labs said. and that child is 18. What are we going to tell that parent? This is again one of those HIPAA questions that you will see. And you need to get permission from that 18-year-old. If they're awake, alert, and oriented, this child is in charge. They sign their own admission papers. We need to get permission from the child to even speak in front of the parents when they're there. What is palvizumab? Synagist. What is it used for? Hmm. Remember, this is a monthly immunization for RSV. We use these in children like cardiac children, premature children that's been prolonged ventilation, cystic fibrosis, kids that are immunosuppressed. We're going to give it monthly, and that's for the first year of life, usually from winter to early spring, is to prevent all of that mucus from going. What causes a PDA? Indomethacin. What medicine can be used to treat an infant that's in the acute phase of RSV? So you get a kid in, they have RSV, and we need to give them something to try to help them. Remember, RSV is a virus, right? Respiratory syncytial virus. And this actually was a question off of a HESI several years ago, but I keep it here, and it is Virazole. And that OLE is your virals, okay? So ribavirin we'll be giving. It's an antiviral, works. What's the highest priority for a preoperative infant with bladder exstrophy? Highest priority. Hmm. The biggest thing is anything that's born on the outside. The biggest priority is infection. Yes, we're going to be monitoring all of these things. Yes, we are. I mean, the bladder is still connected, but the big thing is the skin integrity, making sure it's covered, preventing infection. It's a brand new infant that will kill them. They don't have an immune system. A smart 8-year-old wants an insulin pump for type 1 diabetes. Should we give an 8-year-old an insulin pump? If you can imagine, they put these insulin pumps in, and I've spoken to some students who actually had these pumps, and they keep one needle in for a week. I don't know what the protocol is, but it's better than getting a bunch of sticks all the time, right? And a 10-year-old can have it, maybe an 8-year-old, but it has to be an 8-year-old who really understands the dynamic of the pump and can problem solve it and knows how to check their blood sugars and how to give themselves boluses of regular insulin. A multi. Why would a line test be done on a child? I remember seeing this one kid who came from us from out of state and had all of these weird things going on and they couldn't figure it out. And in the end, it ended up being Lyme disease. It's hard to detect, if you're not thinking out of the box. It is to see if there's tick bites. And the testing is usually 1 to 2 weeks after exposure. Usually they see those big welts, those big redness, and that's usually where we go, this could be, and let's test for it. Treat it now before it's worse. What assessment would you see after administering an IV bolus of albumin to a child? We talked about doing this with glomerulonephritis, right? Protein's being lost, so let's give some albumin, which is protein. And then let's follow it with some diuretic like furosemide. And usually it'll pull the fluid out and the child will urinate more. When you urinate more, It's going to pull out the fluid, it'll urinate more, and in some cases, it will take the fluid, pull it back into the system, and your heart rate actually can come down with it because fluid dehydration is more elevated. The fluid's going back into the vessels where it needs to be. A male infant is born with epispadias and they cannot circumcise the child. Why can't they? What is epispadias? Remember, there's epispadias and hypospadias. And not being able to circumcise it is, can be a problem in some religions, like the Jewish religion. They like to do the brisk right after birth. They need it for plastic surgery. They, under general anesthesia, fillet the penis open. They create a canal and they put a catheter in. They use the foreskin to seal it up and put that the end of the penis will be the end of the urethra. And it's not going to be on the bottom or on the top. And we leave that catheter alone. Just put it in a diaper. A child is wheeled into the ER, leaning forward, drooling, no cough, severe stridor. What is this? I think when you see things like drooling and stridor, this is all upper airways. Something's going on there, right? And we know it's beyond croup, it is epiglottitis. Asthma is expiratory wheezing. Stridor is usually considered inspiratory. A multi. To diagnose Duchenne muscular dystrophy in children, an EMG may be done. What teaching do we need to tell the parents and the child? An electromyography. It measures an electrical current, gives a shock to a muscle, and we see how quick it contracts. So we're actually putting these children through a gym exercise, and they can be quite uncomfortable when they're done. So tell them it's going to be sore. And we know it measures the muscles, and these kids usually will get some Tylenol or Motrin. But telling the parents and the child it's temporary, it's just like they did a big exercise. A multi. What conditions would you suspect on a newborn Down syndrome infant? And this could be AV canal also, right? If you want to talk about one of the names, congenital heart, VSD, common, AV canal, truncus are the biggest things that you'll see. But again, it's hypothyroidism. Those are the two big things, and they're also more prone to leukemia. Those are big threes on Down syndrome that you'll see again. They like to take that information and put it on questions. A child admitted for persistent vomiting and diarrhea. What assessment's most important? And I want to know what the pulse is. That's number one. That is right now current what's going on. Skin turgor, urine output, capillary refill. Yeah, that helps, but that apical pulse is very high. I know we're in severe trouble. A multi. What information would the parents and child need to understand about impetigo infecciosa? As I said, my little grandson was sent over here with what mom said was she scratched a mosquito bite too much. And I went, no, 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 that's impetigo. Impetigo, it spreads. You'll never pop the vesicles because that juice, that serous secretions spreads it. And it's extremely contagious. So gloves, wash your hands, and it can leave some scars there. They give topical and oral antibiotics on that. A multi. What is another word that is used to describe erythema infectiosum? One of the last chapters is all on some infectious diseases in children. So I put it here so that you would have those um, common questions that you could see. I mean, if you look at the child's face and you look at it's slap face or it's fifth disease. Again, it's a viral infection, and also you might see a rash on them with fevers, and those are the names that you'll see. What is the treatment for pertussis? This is one of the reasons why we check for immunization status on small children that are coming in with upper respiratory issues. And we're making sure it's not pertussis. This is all upper respiratory and azithromax. 5 days is what they give these children, and they're placed on isolation. Multi-select. What are some side effects to watch out for in a child taking antibiotics? Kids don't take antibiotics. They haven't had many chances to take it. So we really need to look out for certain things that can happen. Some antibiotics are worse than others. And it's all the GI stuff. Antibiotics can cause vomiting and diarrhea. There are some that are worse than others. This is why we try to keep away from them, but sometimes we have to use them. And also some abdominal pain. So if they start to present with that, they need to call the doctor and they can change the antibiotic. How do you get rid of cradle cap on an infant? So you can take a fine tooth comb and just very gently after the bath, you wash it with soap and water and you could get it out. They also say you could put mineral oil, something to moisturize it, and that also helps. A multi. Post-operative abdominal surgery child has an elevated heart rate and respiratory rate. What assessment might you make from that? What is that telling you about the child? It can be anything. Now, there are kids that are paralyzed, sedated, and you'll see elevated heart rate, respiratory rates, and you're like, well, what is it? Well, they don't have a fever. Their fluid status is good. Oh, they must be having pain. So those are the three things we rule out with elevated heart rate and respiratory rate in children, and we treat it with pain medicine. A mother whose child has undergone chemotherapy asked the nurse about her child receiving immunizations. What does the nurse tell her? So we're going to delay them for at least 6 months, and especially live vaccines, because they are immunosuppressed, and we do not give immunizations then. What can cause rheumatic fever? And that is good old strep throat. An adolescent girl wants information regarding birth control. What does a nurse do? Does she give this child information? You give written and oral information without putting your bias in there. Just give the information to the child. Yes, you can. A multi. A child with hemophilia fell down hard on her knee. What is the treatment? So they're at home, the kid fell down. and it's really hard, and we're starting to see swelling already, right? Hemophilia. What's hemophilia? That means they bleed easy. What are we concerned about? The joint filling up with blood. What do we do? Well, it's rice. Rest, ice, contain and elevate it. And if they have that factor at home, they'll call the doctor first, but they're going to be giving it at home. And we know the stuff that prolongs bleeding coagulopathies is NSAIDs and aspirin. They should never get it. These children should be on acetaminophen only. A multi. How can you decrease GERD in an infant? Gastroesophageal reflux disease. Grip them well, add the rice cereal. It holds it down. Have them elevated. Don't overfeed them. And they should be sitting when they're done for at least 30 minutes. All those things do help. A multi. What is priority information needed during the initial assessment of an infant with a fever of 101 and cough? Hmm. What would you like to know? What are you worried about with this kid? And it's all about immunization status, like I just said. Then, if we are having them in the ER or admission, it'll tell us where to place them. Also, medications. What did they have? When can I give more? And of course, always allergies. Very good. A multi. What precautions should be taken for infants born with myelomeningocele? Remember, the meninges and the nerves are ripped up from the bottom and pulled out, and they're on the outside of the body. So we know we have decreased sensation and mobility in lower extremities. So again, latex precautions, we're going to be monitoring the bowels, we're going to be monitoring their urinary function. It does not affect airway, has nothing to do with airway. A multi. A 17-month-old eats with the spoon upside down, and the mother says, "Is this normal?" I say upside down, backwards. Kids do the craziest things with it, right? They're playing, they're experimenting. So it's absolutely normal for these children to do it. But why are they concerned? Maybe there's another child in the house that has some sort of, something. And tell her they're just experimenting. They don't know what a spoon is and they're getting used to it. It's normal. A multi. How is juvenile idiopathic arthritis treated? JIA. This is really that weakness and wobbly stiffness in the morning. It's the joint swelling. It's the uveitis also can be occurred with it. But NSAIDs is the hallmark for pain, anti-inflammatory. Methotrexate and steroids are usually started first. Synagist is the treatment for a respiratory syncytial virus. It's not for JIA. A toddler vomited 2 times and is listless and irritable. What do you tell the mother on the phone? I mean, you got a phone call at the doctor's office or at the urgent care. My kid vomited 2 times, but they're just look listless and irritable. What are you going to tell that mother to do? I've seen children have one big, huge vomit and be, hemodynamically, their heart rates are up and their blood pressures are low and they're pale and dizzy. I mean, some kids can vomit and diarrhea and still be okay. But listless and irritable, they need medical attention now. Get them here now. An adolescent status post amputation for osteosarcoma is angry and Blaming the parents. It's always the parents' fault, right? Absolutely normal for that adolescent. They're, suffering. They're in sorrow. They're missing their leg. A multi. How do you assess children's outcomes that are on the treatment for hypo or hyperpituitarism? What are we going to be monitoring? Again, height and weight, right? This is all about growth hormones. And we're going to measure height and weight, and we know what's going on. If they're on treatment, is it working? And if they're not on treatment, why are they so slow in the growth? Another multi. To diagnose a congenital heart defect, the child must undergo a cardiac cath. What are the risks? Our biggest thing is bleeding. Remember, you always check that dressing first. Those pulses, because of the big catheters, can be decreased. Usually no fever, and usually there's minimal pain once it's removed. I'm multi. An infant with TE fistula, what should the nurse have at the bedside? Tracheal esophageal fistula, a connection between the trachea and the esophagus. So we need suction because they're keep aspirating on even their own mucus and keep the head of the bed elevated. These children are not going to be fed. Feed them, and it's going to go directly into their lungs. How would you promote normal growth and development on a child with esophageal atresia? So this kid doesn't have a connection between the mouth and the stomach. They can't eat. This is when you give them a pacifier. Really important thing. And remember, infants self-soothe with their mouths. So give them that non-nutritive sucker, that pacifier. A multi. Child's been having diarrhea for 3 days. What should the nurse assess? So, I mean, we can do the temperature, but most of all, diarrhea. We were looking at dehydration, our fluid-based balance, blood pressure, heart rate, urinary output. Those are the big three. A multi. What assessment findings would you see with a child with cystic fibrosis? So again, growth delays because they're not getting nutrition. Excellent. Their lungs are no good and their stools really smell and they're going to be skinny. A multi. What assessment would alert the nurse that an infant is in acute respiratory distress? So again, nasal flaring, tachypnea, and retractions. What symptoms usually bring a child to the doctor and ends up with a diagnosis of acute lymphocytic leukemia? I mean, we don't know if we're going to get it, but there's always these symptoms that you see. And it's bone pain, fatigue, and ecchymosis, and usually a little fever in there also. Very good. A multi. When teaching a child about sickle cell disease, a nurse should include what? One of the things to remember, any child that's immunosuppressed, they're all taught. If you have a fever of 100.5, they need to seek medical care. It is telling you there's an infection occurring and we need to get it now before it gets worse. Sickle cell, hydration, hydration, hydration. And they're usually sent home with like a Tylenol number 3 for pain, even the children, and to take it before it's too bad because then it's not going to work at all. A newborn is diagnosed with transposition of the great arteries. What is priority treatment? So there's no connection between the lungs and the body. This is the one that we need to keep that patent ductus arteriosus open, and that is prostaglandins. They will get an arterial switch, but usually they can wait up to a week later. It's not a rush as long as they keep that patent ductus arteriosus open. A child with sickle cell goes to the ER with severe pain in their left knee. Priority treatment to decrease pain is what? The priority. Well, when we look at sickle cell, what do we need to do? It's all dehydration that causes those cells to clump, and that what causes the pain. You can give pain medicine, sure, but you're not treating why it's in pain. Give the fluid bolus, get those cells moving, and of course have the pain medicine too, but it's fluid. A multi. What's a ventricular peritoneal shunt used for? So there is fluid in the brain, hydrocephalus, and it decreases the pressure and it drains into the peritoneum. It's not to drain the peritoneum, it's the brain that's extra fluid in there. We need to get rid of it, and the little tube goes right into the peritoneal cavity. Works well. What would you see with a child with autism? It's repetitive behaviors. Very good. A multi. An umbilical hernia is becoming hard and painful. What should you tell the parent to do over the phone? They called you on the phone. They want to know. What do you do? I mean, I like the nice soft ones. I can push them in and out. They're a lot of fun to play with. If it's hard, this is an emergency. It's strangulated, it's incarcerated. It means the bowel is dying. So make the kid NPO, get them to the ER so that they can do surgery and to relieve that kinking of the intestines and save it. At what age should solid foods be introduced to an infant? And that's 6 months. And we do it 4 to 7 days, one at a time, and look for allergies. How would a nurse examine a newborn with suspected cryptorchidism? What is cryptorchidism? And this is the one that we have in a warm room because warm, the testicle sac will come down, and if the testicles are in there, it's going to be coming down also. What acid-base imbalance is caused by hyperventilating? There are times when you will see up to 4 different acid-base questions, something you should look at. Respiratory alkalosis is hyperventilating. A multi. A child's fallen and a stick has scratched their eye. What should you tell the parent or child to do? So they need to go to an ophthalmologist, and I would tell them to put something over their eyes so that they're not looking, causing the blinking. We don't know if something is embedded in the eye, and we're trying to save eyesight. A school-age child with reoccurring dermatitis, eczema, what suggestion would a school nurse provide to parents? Reoccurring dermatitis, eczema. These children at times will get so ooey and gooey and infected from itching that at that time, these kids need to stay home because of the infection, and they need to get it cleared up before they come back in. Has nothing to do with homeschooling or cotton gloves. Yeah, we keep their nails short, but they do have flare-ups and they need to stay home for infection purposes. A multi. Why do you give aspirin to a child diagnosed with Kawasaki disease? Remember Kawasaki, it's that systemic vascularitis which can affect coronary arteries and cause aneurysm, right? So we give aspirin and we give IVIG, and it's anti-inflammatory, it prevents clots, it thins the blood so that the blood can flow. It's like giving an aspirin for an MI, right? Newborn child had suspected CHF. What confirms this? Newborn. And it's tachypnea with centralized stenosis with crying. That's the definition of it at birth. How do you medically close a patent ductus arteriosus? What's the medicine to close it? Indomethacin. Excellent. Synergistis for RSV, prostaglandin, keep it open. A child post-tonsillectomy swallowing every 2 minutes. What does a nurse need to assess? What is she worried about? I mean, if you see that picture, there are these big scabs that they cut them and cauterize them, and that's what's left in the throat. So these children, we need to like, no, you're not going to open it and tongue depressor, no. But you'll open it and you'll see blood on the tongue, and you'll see bright red blood. And that child needs to get to the doctor, and they need to take it to the OR and recauterize it. A child is walking on their tippy toes all the time. What would you tell the parents? I'm talking like the toddler. They don't know, they don't walk on their feet. They're always on their tippy toes. What are we worried about? Are we worried about? This is the one that we are going to refer to a neurologist. I had one of my daughter's friend's child who was on the tippy toes all the time, and she is autistic. And it was that first symptom that showed him something wasn't right. She wasn't flat feet, it was always on her tippy toes. How would you treat epistaxis in a child? Nosebleeds. What do you do? And that's the finger and the thumb. Hold it. Have them forward. You put them back, they swallow it. Put them forward. Hold it 10 minutes. If it doesn't stop, they need to seek medical care. A multi. What might you see with a child experiencing severe diarrhea? Remember diarrhea? The intestines has all those digestive enzymes and they're alkaline. So you're losing alkaline like crazy. So you're left with metabolic acidosis. And of course, you always worry about hypokalemia. A parent called the nurse to ask what over-the-counter meds she can give to her child that has welts on her arms and is now up her neck. If you ever work in a pediatrician's office, these are questions she'll get. This could be going into anaphylaxis. Get her to medical care now. What lunch would you choose for a child with celiac disease? Remember, no wheat, rye, barley, oats. Which one here works? Baked chicken, coleslaw, soda, frozen desserts. The rest have bread in it somewhere. A multi. What treatment should a child in pain with JIA have? NSAIDs for pain. Now, some children like cool baths, some people like hot. Do not give me a hot bath, it makes me worse. Give me an ice bath and I'll be happy. And of course, distractions always work with pain in children. Highest priority for a child with sickle cell. And that is fever. If a sickle cell child has a fever, this child is immunosuppressed, and this could create more problems. Now, it is 10:30. Do you guys want me to stop, or you want me to finish the last 20 questions? It's up to you.
I would like to stop here personally. I'm just a little tired.
I know you guys are burnt out. I will send you another recording with this one that also has the end of it too. So then you'll have it all. Okay. I understand that. Most of you have come also from community. So I understand.